to be sternoclavicular. This is acromioclavicular. This is, yes, the head of the humerus. So it's going to be the glenohumeral joint. Okay, here's your coracoid process. And so this is actually pointing to the scapula. So what we're looking at here is that scapulothoracic articulation, which is really not a true articulation. It's not a like bone on bone. It's just the fact that your scapula has to glide over that rib cage. Huh?
Sorry, I was telling them.
Thank you.
Yay, we got him right. So when we're talking about the shoulder girdle, we're going to use this term to discuss activities of the scapula, the clavicle, and the sternum. Okay, so shoulder girdle is really scapular movement, as opposed to glenohumeral joint, shoulder joint, which is glenohumeral. Okay, so that's a big distinction. That's where people get confused. Is most of the time when we're talking about big movements, flexion, extension, abduction, all that, that's glenohumeral movement. Okay, when we talk about things like elevation, depression, rotation, scapular rotation, that's all scapular or shoulder girdle. Okay, so the sternoclavicular joint and the acromioclavicular joints allow for shoulder girdle motion. Okay, so these two joints, they don't move big. It's not something we're going to measure, but that little bit of movement has to occur in order for the scapula to do what it needs to do. Okay. So here's a picture actually out of your book. So this is just looking top to bottom. Okay, so this is going to be the front. So here's the clavicle, there's rib, or no, actually we're looking from the front. Because here's your clavicles, here's a rib, first rib, and then here's your sternum. Somebody's lost back there. Okay, so what are the movements of the shoulder girdle? So I'm going to say it one more time when I say shoulder girdle. You say scapula. Shoulder girdle, scapula. Sorry, I'm switching into cheerleader mode.
It works.
I'm trying to keep myself awake. Yeah. All right, so the movements of the shoulder girdle or the scapula are going to be elevation. Can you get your chest back? I don't know. Depression. Okay, protraction is like shoulder forward. Protraction is not this, but this. So it's the old thing, and some of y'all young ones always look at me like I'm crazy. You put your two hands out and you like just push one forward. Like, look, Mom, one arm's longer than the other. Okay? What you're doing is you're protracting the longer one. If you really make one really longer and one really shorter, you're protracting the longer one and retracting the shorter one. And you can switch. Okay? So protraction, retraction. Okay. Okay. So what it looks like, I need to look at the scapula to show you. So what it looks like is protraction, retraction. Protraction, retraction. Okay? And then we're going to have rotation. So we're going to have upward rotation and downward rotation. These are my scapulas. Okay. I'm going to go get a scapula and I'll show you.